When Michelle Obama was working on the campaign of Get Up and Go Play for Kids, that is a public health initiative. Welcome back to my channel. Make sure you visit careersavage.com if you're looking for personalized career advice. Today, as you can tell by the title, we're going to be talking about a master's in public health versus pursuing your nursing degree. Someone left this in the comments, and like I've told you all, when you leave comments on videos that you suggest, I always add them to my queue, and this was at the top of my list. So let's get started and get into today's topic. So what is the main difference between pursuing your master's in public health and pursuing your nursing degree, whether that's an RN or if you go on to further your education to become a nurse practitioner? The same differences between an MD and an MPH are going to be the same thing for an MPH and an RN. For an RN, your main job is to work with patients. You are treating diseases, whereas someone with a master's in public health is going to work towards preventing those diseases. Public health professionals generally do not work with patients. There are going to be those one-off instances. For example, if you work at a community-based organization or you have been tasked with doing focus groups, working with patients of a specific disease state, then you're going to be working with patients, but you're not treating patients, you're still doing preventative work. Whereas for an RN or anybody with a nursing degree or anyone who is a nurse, patients come to you because they're sick. Something has happened. They have a disease, they have an illness, they have an issue, and they're coming for you for treatment. Those are the distinct differences between a nursing degree and a public health degree. Preventative in nature, treating in nature. When I explain certain things, I love to give scenarios for those who are newer to my channel. For those who have been here for a while, you already know that. So I'm going to give you the example of when Michelle Obama was working on the campaign of Get Up and Go Play for Kids. That is a public health initiative. During this time, I don't remember if it was 2009 or 2010, there was this increase in children having or becoming obese, and people chalked it up to being stagnant, watching TV. Michelle Obama and her team came up with this idea of Get Up and Go Play. And if you were watching TV at the time, you saw all those infomercials, all those billboards, and all the campaigns all over the United States tasking kids to get up and go play. That is a public health initiative. You see an issue, which is obesity, and we know obesity can lead to type 2 diabetes, high cholesterol, high blood pressure, a multitude of issues. So someone with a public health background likely worked with Michelle Obama and her administration to push out that campaign. A nurse would not work on that campaign because your job isn't to prevent illnesses, your job is to treat them as they've already happened. And this is why I like public health, because we work to solve those problems. So if a child was obese, a child would be experiencing high blood pressure or high cholesterol. Because of those issues, they may be experiencing other problems and have to go to the emergency room or the doctor. They go to their doctor admits them or starts treating them, the nurse comes in to take the vitals to help treat the patient and this underlying illness. That was a long-winded scenario, but I really do like that example because it goes to show how circular the issues are. You know, we have the root of the problem, and public health professionals are always trying to get to the root of the problem, whereas nurses are trying to get to the root of resolving the illness so you can go back out and do whatever you're doing. But the diabetes and the high blood pressure and the high cholesterol are always going to continue unless you get up and go play. See what I'm saying? The other stark differences between public health professionals and people pursuing their nursing degree is like your work schedule. Most public health professionals have 9-to-5 jobs. You know, you work your regular schedule, pretty flexible for the most part. But as a nurse, your job is extremely demanding. You're always on your feet. You're always moving around. You're sometimes working 12-hour shifts at a time. And not to say people who are public health professionals don't work 12 hours at a time, because I've had 13, 14-hour days, but it's not a consistent thing, whereas a lot of nurses have that consistent schedule of working 12 hours a day. The other difference is going to be in compensation. Of course, if you go on to become a nurse practitioner or pursue higher heights, you're probably going to make a little bit more than someone who's a public health professional. But the other thing is the world of public health is so vast that your earning potential is infinite, in my opinion. You can be a regulatory professional, you can do consulting, you can do focus groups, you can work in marketing, marketing, because there's still a marketing aspect to medicine, unfortunately. I don't love that part, but that's something a public health professional would work on. So in 2019, the national median salary for RNs was around $77,000, and then the mean for public health professionals was about $61,000. So there is about a $10,000 difference, but you also have to look back to what I said about working hours. If you're working 12 hours a day and your salary, it doesn't matter how many hours you work, you're getting the same amount every year compared to someone who's only working there 40 hours a week as a public health professional, and we're still getting our annual salary. So when you look at the cost per hour, it honestly levels out to be the same thing if you look at your time with that kind of value. The last difference between pursuing a nursing degree and pursuing, becoming a public health professional is that, as I said before, when you get your master's in public health or you pursue a public health degree, your options are vast. You can do a lot of different things, whereas when you pursue a nursing degree, it's pretty narrow. Not to say you can't do whatever you want, because, where we are in the world, anyone can do anything they want. But if we're just looking at the job options available to public health professionals and the job options available to RN, in the world of public health, it's going to be a lot wider. I also want to note that as an RN, if you're smart with your career and strategic, you can always dip into the world of public health. Like, there's no saying that once you start working with patients, you only are ever going to work with patients. When I worked at a massive Fortune 500 pharmaceutical company, my boss actually was a former RN. And I know a lot of people who are former RNs. I think both degrees are great. I think both degrees offer amazing earning potential. And I think with both degrees, you can truly make an impact in patients' life. I hope this helped someone. If you want to hear more about public health or you have any questions about the difference between an MPH and another degree, leave those comments down below. Make sure you're subscribed, guys. And until next time, bye.